Hi, this is Dr. G. Sarath Babu, consultant nephrologist at SINU, Dr. Sarath Institute of Nephrology, Urology, Vijayawada. Today I'm going to speak about urinary tract infections. Urinary tract infection means infection in the tract. What is that urinary tract? That includes lower and upper urinary tracts, the ureters, the tubes that convey urine from the kidneys to the bladder, and the kidneys, both combined will form the upper tract. The urinary bladder and the urethra. Urethra is the tube that transports urine from the bladder to the outside. Those two form the lower urinary tract. So the bacteria entering the urinary tract through the urethra and spreading to the bladder primarily cause UTIs. The urinary system is intended to keep the germs out. However, the defenses do occasionally fail. When that happens, UTIs are very prevalent health issue that affects millions of individuals every year. And these infections can occur anywhere in the urinary system. And women are more likely than men to develop urinary tract infections. An infection that is restricted to the bladder, it can be uncomfortable and irritating. However, if UTI spreads to the kidneys, it can cause major health problems. So what are the factors that contribute to UTI? One is a stone in the ureter, kidneys, or bladder that blocks the flow of urine through the urinary tract, and frequently holding the urine or avoiding urination. And any narrow tube in the urinary tract that slows the flow of urine. So, and also use of spermicide or a diaphragm for birth control can potentially lead to more UTIs. And sexual intercourse itself will be a risk factors for urinary tract infections. So what are the types of urinary tract infection? As we discussed, the upper tract and lower tract. So upper tract is infection in the kidney and ureters. Lower tract is the infection in the bladder and urethra. So once we develop infection either in the upper tract or lower tract, what are the symptoms? How will you recognize the urinary tract infection? If it is infection in the upper tract, that means infection of the kidney and ureters. So you develop sudden onset of severe flank pain, high-grade fever with chills, nausea and vomiting, extreme weakness. All these things can be symptoms of upper urinary tract infection. If it is involving the lower urinary tract, especially the bladder and the urethra, so you tend to get more of irritative symptoms like increased urination, frequency, urgency, and sense of incomplete voiding. And you may have blood in the urine, that is, and along with the fever. So, and in women especially, they may have that feeling of uncomfortableness above the pubic bone. These are the symptoms. So, how you are going to diagnose urinary tract infection? So, most of the times, clinically, when the patient diagnosed that the patient is probably having urinary tract infections, and further we'll confirm it with the most common investigation is the complete urine examination. Once we do complete urine examination, we look for pus in the urine, RBCs in the urine, and presence of nitrates in the urine. All these things indicate the patient is suffering from urinary tract infection. Further confirmation requires investigations like urine culture. Urine culture gives exact bacteria which causes the infection. The most common bacteria involved in urinary tract infections are the E. coli, Klebsiella, Enterococci, and occasionally Pseudomonas. These are the infections that commonly affect the urinary tract. So those can be diagnosed with urine culture sensitivity. And sometimes we may need to do ultrasound of the abdomen to look for the kidneys, any obstruction in the tract, any stone, tumor, or any other swelling of the kidneys. All those things can be diagnosed with investigations like ultrasound of the abdomen. And if required, we may have to do CT scan of the kidneys. So few of the people may develop recurrent urinary tract infections which require further evaluation. That means they may require investigations like IVP, intravenous pyelogram, cystoscopy, along with the previous investigations. So they give us clue about anything which is causing obstruction, stone, or anything tumor, which is the cause of recurrent urinary tract infection. So Once you diagnose the urinary tract infection, we need to treat it with antibiotics. If it is upper tract infection, they need IV antibiotics. If it is lower tract, it may be with simple oral antibiotics may suffice. So we know that somebody develop urinary tract infection. How to prevent it? So prevention is better than cure, as we all know. So prevention of UTIs, large doses of vitamin C restrict the development of certain bacteria by acidifying the urine, and urinate whenever you feel the need. Do not wait. After each bowel movement, clean the perineum and urethral meatus from front to back to reduce concentration of pathogens in the urethral opening. Do shower instead of bathing in a tub because germs in the bath water might enter the urethra. Before and after intercourse, clean the vaginal region and urinate immediately. And women should not use feminine hygiene sprays or scented douches. And during the day, void at least every 2 to 3 hours and totally empty the bladder. Small doses of frequent antibiotics are sometimes required, especially for people with recurrent urinary tract infections. We need to give prophylaxis for 3 to 6 months, depending on the patient's condition. We need small dose of antibiotic at bedtime for 3 to 6 months to prevent recurrent urinary tract infections. And always do drink plenty of fluids, at least 3 to 4 liters of water. Water is very important to flush the system so that the chance of developing urinary tract infections will be less. Thank you.